Okay, so what we're going to do, the lips, open your mouth a little bit. The lips, what I'm going to do is the Swift technique. Okay, so basically, we already numbed and wiped and cleaned the lower lip where I start, and the right side is usually less painful, so that's why I start from that side. Okay, and the lower lip is also less sensitive than the upper, so we start with the lower lip. So I go from the corner, kind of 1 millimeter, and not too superficial, not too deep. If you go too deep, there's the labral artery, so that's dangerous to inject into that, and not too superficial, so that we don't have bumps. And then immediately after each injection, I do a little bit of tiny massage. And then the filler has also numbing medicine, so now because I injected this area, so there's also some numbing from the injection there, and I keep moving forward. So that's what's called the Swift technique. And then again, immediately we'll massage, keep moving. Again, this a little blood, that's not a worry, that's all from the mucosa, that's not a bruise. When the lips, potentially they can bruise actually more than other areas, but when they bruise, usually you see a blue discoloration from a vein or artery, a puncture in the lips. So far I don't see any of that. Again, my patients, the lips are very easy to bruise, are very easy to swell, but it is also very fast to heal. They really heal fast compared to the skin. So not a worry if they swell or bruise, they'll be back to normal in no time. Okay, keep moving. Again, the best time to a little massage and to smoothen out the fillers actually just immediately after you inject it, as I did now. Okay. Again, I stretch, I pull the lip as well as I'm injecting, because that will keep actually the depth of the needle the same throughout the injection. So everything taken into consideration. I always tell patients, sometimes you think like, oh, I'm injecting quick, whatever, but each single injection is actually, a lot of things are taken into consideration. The speed, the depth, the distribution, the beginning, measuring, all that has to be accurate to get the best results. And the corner, for example, we inject a little less, so the lips like really looks nice and rounded and not in the shape of sausage if you inject a lot to the sides. Okay, I'm glad to make you laugh. While you have needles in your lips.